Good afternoon, everybody. I am Amber Lee, the Alaska State Director for Protector Care, and I want to thank you all for joining us today as we celebrate the 15th anniversary of the Affordable Care Act. So, 15 years ago, the ACA opened the door for millions of Americans to access health care that they need, and tens of thousands of Alaskans. And today we're hearing directly from Alaskans about what that has meant in their lives. Thanks to the ACA, we've seen major gains in coverage through Medicaid expansion. We've seen more people able to afford healthcare because of enhanced premium tax credits. We've seen protections for people with pre-existing conditions and better access to healthcare for self-employed folks and small business owners. There's still work to do, and ongoing federal proposals could impact these gains. So it's more important than ever that we listen to what healthcare access really means from real Alaskans. And I'm honored to introduce speakers from all over the state, and each of them will share a bit about who they are, let us know your name, where you live, and how the ACA has made a difference in your life. And the first person I will introduce is Anna Brawley, and she is the owner of Tiny Birch Consulting.
Yeah, thanks, Amber. And I'll try to keep it short because there's so many things I can say. So trying to just narrow it down to what the impacts have been. So I'll go through a few of them. I really appreciate that the ACA has been in place for 15 years. And I'll just give some examples of how it's impacted our lives. One is the insurance exchange. So my partner is a small business owner. He's been a small business owner for a long time, and we met when he was a single dad with two kids. So the ACA passing was really his first opportunity to really afford health insurance since he bought the business years ago. If you're not familiar, insurance premiums in Alaska are hundreds of dollars a month, especially on the exchange, even with the tax credits. And so it's really been a lifeline for our family. Second is preventative care. I think we forget that the ACA really helped make preventative care and primary care, going to your regular doctor and not just going to the emergency room, possible for more people. So for years, we've gotten our free flu shots, we've gotten our primary care appointments, and really made sure that we're maintaining our own health. Pre-existing conditions, that was another thing addressed in the ACA. That's been really critical for my partner's kids, especially a daughter with a lifelong heart condition. Since she was born, really it's been, she's healthy now, but she's gone through some tough times too, and they have. So it's been a lifeline for her, not just as a kid, but really to stay on her mom's insurance after graduation and be able to still have that care. She's also moved down to California, going to school and working, and so she's able to access Medicaid, Medi-Cal, really in California. That's again been a lifeline, not just for her to stay healthy. Again, she has those health issues, but also it's already saved us thousands of dollars in medical bills all the way up here in Alaska, and much better access to care than just using Alaska insurance down in California. Lastly, I'll share just a little bit of personal story. I am a stroke survivor, or a TB, what is it? GIA, I forget the acronym, a mini stroke. So in 2021, I was lucky enough to have employer health insurance and was able to take leave. And so I was able to take care of myself, get back to work. Fast forward to today, I'm fully recovered, but I'm also self-employed because I serve as a local elected official as well. So it's really impossible for me to hold a full-time job and get that coverage. So the tax, the in, sorry, the exchange and the tax credits really mean that I'm able to afford care, that my partner's still able to afford care. And if something like that happened today and I didn't have insurance, we would be bankrupt and I would not be able to work. I would not be able to take care of our family. So there's just so many ways that the ACA has really benefited our family personally, and I know so many Alaskans as well. Thank you.
Thank you so much, Anna. Thank you for sharing your story. Next up, I'm going to introduce Erin Jackson Hill. She is the Executive Director of Stand Up Alaska.
I don't know where I'm at. Good afternoon. Hi, I'm in North Carolina, so I wasn't exactly sure what time it was there. My name is Erin Jackson Hill, and I am the executive director of Stand Up Alaska. And the ACA has actually saved my life multiple times. I am a recovering alcoholic, and what once filled me with shame has now become like my most powerful tool for change. And it's one of the reasons why I'm on this call. I've chosen to share my experience to highlight the critical need of healthcare for all people. I started drinking during a tough time in my marriage and career, and like many, I struggled with undiagnosed mental health issues. And although I had good insurance and access to outpatient rehab, I could not afford inpatient treatment, which was the care that I truly needed. When eventually I lost my job in April of 2014, I also lost my insurance. And by June, I was in the hospital after trigger alert, a failed suicide attempt. And I was unable to afford COBRA payments or any type of private treatment. Desperation led me to apply for Medicaid, but in Alaska, the wait for inpatient treatment bed was months. And I was terrified knowing that I might not survive that long. A counselor suggested that I fly to Washington, where I enrolled in Apple Care, which is their Medicaid program, and I had access to immediate inpatient care. Within a week, I was in treatment. 5 weeks later, I walked out a new person, and that was really thanks to the Affordable Care Act and my family's support. And so, to follow up, a couple of years later, I was in need of a hip replacement, but am self-employed, and I was lucky enough to be able to purchase healthcare insurance on the health exchange. And so I was able to get my hip replaced, which I'm happy to say it has healed quite nicely. And so today I fight so others don't have to go to such lengths to get help. Um, a continued expansion of Medicaid would ensure that no one has to choose between their health and their livelihood. Addiction and mental health ish struggles can affect any of us. And the cost of inaction is far worse than the cost of care. I mark my sobriety anniversary every July 1st, and it's been almost 7 years, and I am completely committed to this fight. Healthcare for us at Stand Up Alaska is a human right, and together we want to make sure everybody gets the care that they need. Thank you.
Thank you so much, Erin. Thanks for sharing your story. And we are so grateful that we have you fighting for us. Um, the next person I'm going to introduce is Alan Harris. He is a small business owner. He owns All Star Moving in Anchorage. You are on mute, Mr. Harris.
Okay, there we go. So I'm very fortunate that I am in good health and have been in good health most of my life. But when I started my moving company 18, 19 years ago, I was working my regular job, which provided my health care insurance, and then I was working also every Friday, Saturday, and Sunday with my moving company that I own. And so the great thing about the Affordable Care Act is that I was able to get proper health insurance, which would cover any, traumatic type event that could occur to me, just in case. Like I said, I'm very fortunate that I'm in good health, but I would have never left my regular job with guaranteed insurance had I not had the opportunity to purchase insurance that covered all the crazy things that can happen to a person. So that is one of the most wonderful things about it for me. The other great thing is that as a small business owner, every 3 months you have to make your quarterly tax payments. And since the Supreme Court ruled that ACA payments also count as tax payments, when you reconcile your taxes at the end of the year, that is a great benefit to me just because like most business owners, sometimes you maybe are holding on to that money for a project or something else. And then you get to the end of the year and you're like, oh man, I owe all this money in taxes. So the great thing about the ACA is every month I don't take the subsidies and I put money, I pay the whole health care myself. And then at the end of the year, a portion of that comes back to alleviate some of my tax concern, which is fantastic. And then someday, of course, I will get sick like everybody else. And it is wonderful to know that everything is covered. I don't have to worry too much about illness and sickness, and that I can open a business, run the business, and not have to stress out about something that people should just kind of have access to anyway without killing themselves just to get. So that's my story.
Thank you so much. Thanks for
All right.
sharing your story.
Good luck, everybody.
Thank you. The next person that I am going to ask to speak is Miss Essie Frank. Essie?
Hi, everyone. My name is Essie Frank. I'm from Fairbanks, Alaska. I'm a caregiver and I'm a Medicaid recipient along with my daughter and my mother. My daughter, she it's just turned 18, but she has SMA, functional dysplasia, gastroparesis, and without Medicaid, I wouldn't be able to get her to see doctors down in Seattle because there's no one in the state of Alaska that can take care of her. My mother, she is a breast cancer survivor. She also is in kidney failure and had just had surgery on her shoulder. And without Medicaid, that would mean end of life, you know, because we wouldn't be able to afford the care. So I am very thankful that have Medicaid, and I'm here to help fight to keep Medicaid going for all of us. Thank you.
Thank you so much, Essie. The next person I'd like to introduce, let's see, Letitia Phillip. Letitia? Let me see. I don't know.
Okay, my signal's not very strong, but can you hear me?
Yes, we can. Thanks, Letitia.
Okay. Hi, my name is Letitia Philp. I'm from Wasilla, Alaska, and I work as a caregiver for about 4 years. And the ACA, the Affordable Care Act, has made a difference in my life as well as my family. My son was born early at about 34 weeks and was early due to some health concerns the doctor had for the both of us. And at the time, although being like full-time caregiver for a private company, I did not have health coverage. And for him being prematurely born, we spent 3 months in the hospital after his birth, and without Medicaid, I would not have been able to afford the medical expenses that we had because the doctor said he needed a PDA closure for his heart. And for that procedure, we were sent into Seattle. And one of the procedures, the first procedures he took was planned, but then the device that they implanted was too wide for him. So he needed some time to heal before undergoing another procedure. So he ultimately had 2 different heart surgeries in Seattle, requiring us to move between hospitals as well during the 3 months that we were in. And Medicaid was the only way we were able to cover the costs of these critical procedures for my son. It made sure that my son had access to the best possible medical care without me having to worry about how to pay for it.
Thank you so much, Letitia. Thank you for taking time. I hope that's your son that we can hear there in the background.
Oh yes, he is. He's one little happy boy. And I did take a photo of him and I that I could send him.
Thank you. I appreciate that. The next person that I am going to introduce is Lucian Dyer, who works with Alaskans Take a Stand.
Hi, everybody. My name is Lucian. My pronouns are they, them. I am the communications director for Stand Up Alaska and Alaskans Take a Stand. My colleague Rebecca and I, who is also on this call, hello, my angel, we canvass sporadically with the lovely ladies at the Hope Women's Shelter in downtown Anchorage, Alaska, where I proudly reside. In downtown Alaska. After some rounds of interviews, we realized two major intersections, which were homelessness and healthcare access. As a team, Rebecca, Aaron, and I created a survey to then send out to our email subscribers. And the survey said that what's keeping Alaskans up at night is the affordability of healthcare and housing. 88% of the folks that took this survey were mostly financially worried. 66.7% of the people that took the survey were worried about finding providers specifically, and also with dental and vision, specialist dental and vision. The three questions that we asked were: what were your experiences with your current healthcare system? What should policymakers or advocacy groups know about your experience? And what would improve your comfort level in our current healthcare system? What we got we got a mix of responses, but I want to share two quotes that I took from two anonymous survey posters. One, I know that Medicaid is my safety net. I am elderly and work several jobs just to get by. When I can no longer work and health fails, just knowing Medicaid is there to ease the burden of my everyday living is everything. Covering my blood pressure meds, disability needs, and simple doctor visits means being able to buy food, clothes, and other well-being basic needs. The second quote that stuck out says, the system is so precious right now that it's easy for me to see it just collapse with less support. In these spread out tiny Alaskan communities, our clinics are life. They are being pushed to their limit. The summary of what folks wanted to really get onto policy members is that healthcare is a human right. There should be no cuts to Medicaid, and that Alaskans deserve better communication. And I agree.
Thank you so much, Lucian. That's really important work that you're doing. The next person that I am going to introduce is Pat Race. He is an much celebrated Alaska artist and a small business owner. Is that your art behind you? It's beautiful.
Oh, this is Crystal Worrell's art.
Oh,
Better
gorgeous.
than my own. Yeah. Yeah, thanks. My name is Pat Race. I'm down in Juneau on Tlickit-on-Ee. The thing I want to talk about today is, I guess from the perspective of a small business owner, I have two businesses. One I started right out of college, which is a kind of a Swiss Army knife media firm. Alaska is one of those places where you have to just take on whatever random projects come through the door. So we started doing a little bit of this and a little bit of that, and that company's still going today. And then we also opened an art gallery comic book shop that sells board games, and it's just this like cute little boutique downtown shop next to the gin distillery, and it's part of Juneau's downtown scene, which has gotten so good lately. Like we've got a bra shop down the street that does custom fittings, and we've got the Devil's Club Brewery, and there's just like a dozen or so Kindred Post, a dozen or so small businesses that are really beautiful in downtown Juneau that really make up the kind of the fabric of our community and the identity of our community. And what I was kind of realizing yesterday as I sat down to think about what I would say today is that a lot of those businesses wouldn't exist without the ACA. When I started my business, I was fresh out of college. I was still on my mom's insurance. I coasted into that dangerous territory where I had no insurance, and I was a young person. I was healthy. I didn't think about it because you don't think about insurance until it's too late. And then my dad had a heart attack, and he was a small business owner himself, and he's not married to my mother, so he was on his own. He had to pay north of $100,000. I think it was $120,000 to medevac to Anchorage and get a stent put in when he had a heart attack, and that became debt, and that became a burden. He was in the fortunate position of being able to go back to work for the state of Alaska and get his Tier 1 benefits, which is a gold-plated generational pull-up-the-ladder healthcare program that none of us are eligible for. So that's not an option for me, but it did terrify me. It made me realize that as a business owner, I couldn't exist if something like that happened. I had no options, no recourse. And so, my business partner and I had serious conversations about shutting down our business, going and finding jobs, working for a big company or a governmental organization that has healthcare, and they force you into these little like rabbit paths. And I don't like it. I think people should be able to pursue their interests and their skills and their talents and their acumen. But fortunately, the ACA rolled around and we didn't have to shut down our business. And this whole wave of cool little businesses just started popping up all over town. And I called a couple of friends yesterday just to kind of gut check this. And I said, were you able to start your business because of the Affordable Care Act? And they said, absolutely, yes. Like that removed the one obstacle from starting a business. There's so many of them. And not being able to afford healthcare, not being concerned about your employees being able to afford healthcare is such a huge obstacle. And just sorry to talk so long, but to put that in context, there are 3.3 million small business owners in the United States, and self-employed workers, and 1 in 5 of those rely on the Affordable Care Act for marketplace coverage. So if that were to go away, that would impact a huge segment of the economy. Small businesses employ nearly half of the American workforce and represent 43% of our GDP. So that means pulling out the ACA, harming the ACA, reducing the benefits from the ACA, that's a huge linchpin in our economy. And I think that that's a case that the small business associations and chambers of commerce need to be making, as we enter this era of chaos and uncertainty with the Trump administration. So thanks for all of you sharing your personal stories. I really appreciate it.
Thank you, Pat. And if you haven't checked out that comic book board game shop, it is tremendously cool. So the next person that I am going to introduce is Sasha Johnson. Sasha?
Hi, my name is Sasha Johnson. I'm from Anchorage, Alaska, and I have been a caregiver for 20 years. And I would like to thank you for letting me speak today. I have been taking care of my aunt all that time during those 20 years, and the Affordable Care Act and Medicaid have helped us pay for her medical equipment, such as a walker, which she needs, and dentures. And we would have to pay out of pocket if we didn't have the Affordable Care Act and Medicaid. And it's just really important to those needs. And that's what's most important for clients that we have. Thank you.
Yeah, thank you, Sasha. Thank you so much. And I'm glad that you and your aunt can access those. I mean, they're things that you can't go without. The next person I'd like to introduce is Shelley Gooden. Shelley?
All right. Hi. Thank you guys for having me and for gathering to do this important work. I want to start out by making a confession, and that is that the Affordable Care Act and the healthcare marketplace becoming available actually was a key to saving my life. So, much like many others here today, I had a great marriage, nice, typical family. My soldier returned from the army in Iraq. We had a 3-bedroom house. We had 3 cars. We had 4 kids. Things were great. We both worked. We're both agreed. And then I got sick. And we found out what pre-existing condition means. So we had the Rolls Royce of care, everything you can imagine. But it turns out, as I started to struggle with a neurological condition, having had things like previous headaches counted as a pre-existing condition. I was falling in my classroom, and I was asked to take leave because falling in a group of 3rd graders is not ideal. And I soon found myself in a severe neurological design. I was having to get IV medications of things like Solumedrol to try to put a stop to whatever was happening. Those infusions are not cheap. They were not covered. None of the MRIs and things that I needed were covered. And of course, we were getting all of these things, thinking we had great healthcare, and didn't know until the bills started coming back and doctors started calling and saying we aren't getting paid that we even had a problem. I became so ill, I was needing medication, including oxygen, including some kind of mobility aids like a power chair. I became ill very, very quickly. So I wasn't even 40 at that point in time, not really on your radar, right, for this kind of thing. The tests were so expensive, medicines were so expensive. We went from those three cars to one. We went to a tiny apartment with all four of those little kids. And I remember seriously considering whether or not to take my life to help end the burden on my family. That was when we had a presidential candidate come around and start talking about how we could do this. We could get the marketplace out there and we could make healthcare what it is, that human right. We could make it accessible to all of us. Fast forward today, I am a business owner. I'm clawing my way up that ladder. I just registered this weekend to potentially start hiring and have a few folks kind of helping fill in some places where I'm able to do the work that I do and love. Embrace what Mr. Ray said about having our entrepreneurs out there, our business folks able to do the things we can do bravely in our niches because we have care. And anything that would jeopardize that is a big concern for me. Not only do I still manage those medical conditions in the neurological range, you can see I've done well. I don't have oxygen and things anymore. I get out and cause trouble, but I do still have pretty serious diabetes. I'm in my 40s, 50s, and I'm out there with my kids. I have still three at home who are dependent on me. I'm covering my 18-year-old who's high functioning autistic and has needs along with that. I'm covering my 16-year-old who has a similar neurological concern that started earlier with him. And then I have my 13-year-old who has a severe thyroid condition. We think these are all a related host of illnesses that are just family line. But she's not even able to attend public school at this point. So her appointments are very, very critical for her care, and as are her medications moving forward. I pay roughly $205 a month on the marketplace for my insurance, and without the tax credits, I would be running about $2,500 a month, which of course is comparable in Alaska to what I pay for rent for my household. So that's a really tough choice to make. How do I keep all these kids healthy? How do I make sure that I'm still here? And then where are we going to live? So it's critical that these things are in place. And again, looking at other countries like Scotland, my son's looking at moving there for a year. He can pay a $600 fee and get his health care covered for the year for their nationwide health insurance plan. So we got to do better. We got to figure this out. We got to celebrate the wins, and the Affordable Care Act is a win, but we're not done yet, as all of us would say. So thank you guys for being here and doing this and for giving me a chance just to share what it's like for our little family out there.
Thank you so much, Shelly, for telling your story. There are so many of those stories. I think some of us forget what the protections of pre-existing conditions has done for the country. But there's so many of stories of people who just don't want to be a burden on their family, but the medical care is out there. They just can't afford it, and it's literally heartbreaking. So I really appreciate you sharing that with us. The next person I'd like to introduce is Rebecca Reese. She is a project lead for the Medicaid division of Alaskans Take a Stand.
Hi, Amber. My name is Rebecca Rice, and I am from all over Alaska, born in Anchorage, raised in Fairbanks, and I currently live in Palmer. I got super sick in 2021 and I could hardly function. I lost everything and became homeless until the doctors were able to place me on medications. I became a caregiver and was caring for others in between doctor's appointments to try to figure out what the cause of my illness was. I have a very rare birth defect called SMA syndrome. I would not be the productive member of society I am today if it had not been for the ACA to pay for a surgery that I received in December of 2023. It was life changing. I didn't ever think I would make it to the age of 40. And being a single mother, there, like there's other lives that depend upon my ability to be here and be who I am. Um, Medicaid is the difference between life and death. So please, please save and expand the ACA.
Thank you, Rebecca. I know all the good work that you do, so we are grateful that you are here. The next person I'd like to introduce is Judy Jessen.
Hi, I'm Judy Jessen. I use she, her pronouns. I was born and raised, and I'm currently living in Anchorage. I never thought that we would be a Medicaid family, um, until one day I took custody of my younger siblings. Um, I was 28, they were 14, and my husband and I became their parents like overnight. It was one of the best things I've ever done, but it was also one of the most hardest and one of the most terrifying things I've ever been through. Our bills tripled overnight. We were fortunate to be able to make the choice to keep them out of the foster care system, but it meant that we didn't get financial help for any of the costs associated with taking custody of these kids. So our bills tripled overnight. We had to move into a house that fit all of us, so that people weren't sandwiched into rooms. Like we couldn't make dinner without bumping butts with each other. And it was kind of a volatile situation. They came with pets. Teens eat a lot. Um, and they came with a lot of complex medical needs. Um, both kids coming out of an abusive environment had critically high depression screening scores. They had suicidal ideations. They had disordered eating. One of them was so sick and underweight that they had a heart murmur that had been unaddressed. They were behind on vaccines and they just needed a ton of clinical support to start to heal from the trauma with all that, without all of that added on top. We absolutely could not have paid for all of that care out of pocket, and they weren't eligible for a private health insurance because they weren't legally our kids. So thank God they qualified for Medicaid. Medicaid paid for their visits to a really fantastic primary care provider at Medical Park who went above and beyond to do the mental health screenings that caught these conditions at all, and to get my kids bumped up the wait list to start getting therapeutic care right away. So within like 2 weeks, the kids had seen every specialist they needed to. They got caught up on their vaccines. They were active in one-on-one therapy, group therapy, family therapy. We got into the cardiologist. They were on the medications that they needed. Mm, and all of it was covered under Medicaid. I have 100% certainty that that Medicaid provided care is the only reason that my kids are still here. So today in my family, we're not just celebrating the ACA, we're really fortunate to be able to celebrate having two kids who are like really fantastic members of society. They volunteer, they work full time, they took and succeeded in AP classes. They played football all of the seasons that they were eligible. And they're just like two really fantastic young adults who only got a chance because Medicaid was there to catch my family. Thanks, Amber.
Thank you, Judy. I thank you for sharing your story. And I've met Judy's kids, and they are fantastic. And so is Judy. We might have one person join us in a second. I'm not sure, but I wanted to thank all the speakers that we've had here today for sharing these stories. And what the ACA, Medicaid expansion, protections for pre-existing conditions have done for our communities, for our families, for individuals. It's really tremendous, and it is infuriating that it is once again under attack. Rachel, while we wait to see if Rose is able to join us, do we have any questions from the press?
Thanks, Amber. Um, yes, so if you are joining us here on Zoom today and have any questions, you can please drop those in the Q&A box at the bottom of your screen. And if any of your questions are directed towards a specific speaker, you can note that in your question as well, and I will read those aloud. And if you are joining us on Facebook Live, please feel free to drop any questions you have in the comment section, and I'll be monitoring that as well. We do have a question that was submitted ahead of time from someone who couldn't make it here today. That question is for any of our panelists here today. And that is, how have rural communities in Alaska benefited in the long term from the passage of the ACA, as well as programs like Medicaid expansion and EPTCs?
I don't I don't know if anybody wants to jump in, but I can just say that without Medicaid expansion, we would not have hospitals in rural communities. They will, it makes up 40 to 60% of their income. There are hospitals like Bartlett Hospital that's in Juneau that's already struggling with being able to keep the doors open without Medicaid, even for groups in ANTHC, the Native Tribal Health Consortium. I believe it's about 60 to 70% of their income comes from Medicaid. And folks are not able to access the kind of care that they need without Medicaid to help with travel, and especially for in-home care, which keeps people able to live in their communities and from yanking those communities apart. Without those things, we would not have the ability to get care to people out in rural Alaska. It just would not exist. And I know Anna's worked a lot. Anna, you have your hand up if you've got.
Yeah, thank you. And I'll first say, I live in Anchorage and I don't have lived experience in rural Alaska directly, but I've done a lot of work with communities, tribal health organizations, and I think coming from another state, I'm originally from Ohio. It's hard to overestimate how different rural Alaska is. It is not just rural Wyoming where you drive a couple hours to get to the hospital. That's obviously a barrier, but really having to wait, multiple days to get out if there's weather issues and on a plane. And really having most of our specialty care only in Anchorage or only once in a while itinerant workers come through. So I think it's just, and of course, there's so much work that tribal health organizations have done to have health aides, to really bring that care closer to home. And as Amber said, that none of that would be possible without Medicaid funding. It's one of the biggest payers for those communities as well. So it's just so important. And I see Sasha is also wanting to jump in.
Hi, yes. I grew up all over South Central Alaska, and one of the places I go to is rural, and it's on the Aleutian chain, and they usually only have clinics out there, and so it helps with that stuff too, and helps expand there too if they need to be moved from the clinic up to a hospital here in Anchorage or whatever other big city. And it gets really expensive out there with groceries, let alone medical stuff. And that's that.
Thanks, Sasha. Aaron, I see you have your hand up.
I think it's important for people who don't live in Alaska to kind of double down on what Anna said so that folks understand how truly rural Alaska is. There is only a third of Alaska that is actually accessible by road. The rest of it, you have to fly or take a plane. And so the more services that we can provide in rural Alaska is definitely more cost effective than trying to fly those folks to a clinic. So we need to work really hard to keep the clinics and hospitals open in rural Alaska. Otherwise, not only are you're degrading the care that is available in those rural places, it's going to end up being more expensive in the long run to get those folks to care, those who actually make it. lots of times it's a life and death situation in those communities, and those clinics and hospitals stabilize people until they can get to Anchorage. So I don't think that folks that live outside of Alaska understand what we're talking about when we say that Alaska is rural. But when we say that you actually can get stuck in places for days because of the weather, because if a plane can't get in, you're not going anywhere. And so I don't think other lawmakers that aren't our lawmakers understand what we're talking about when we're saying we have to save Medicaid. We need to expand Medicaid because our people are suffering because they don't have access to health care.
I was gonna also, we had Rose O'Hara Jolie. She's a state director for Planned Parenthood Alliance Advocates has joined us, and she was going to speak for just a minute on the Affordable Care Act and Medicaid expansion. Rose? Sorry, they.
Thank you.
I'm sorry.
Thank you for correcting. Yeah, my pronouns are they, them. I am sorry to be late. There are a lot of things happening in Repro Health today. So also apologize for maybe restating some points that others already eloquently addressed. But very excited to celebrate the ACA. I, like probably every person with a body and a family, have a very personal connection to the ACA. My mom defeated cancer because she was not denied coverage because of a pre-existing condition, and is still here kicking it as a really happy grandma. So very, very, yeah. A new baby. My sister had a baby 3 days ago. So yeah, a lot of love happening in our family right now. And so we all know the ACA was incredibly impactful for our communities, especially here in Alaska. So the uninsured rate after the ACA for Indigenous and Alaska Native folks changed from 23.8% to 14.1%, which is an incredibly dramatic drop in people who didn't have access and coverage before the ACA. Another part in Repro Health, especially, is that before the ACA, about 30 to 44% of out-of-pocket healthcare costs were for contraception. And then when the ACA covered contraception, that became a zero net cost sharing for people. So a huge dramatic impact in how much people were paying out of pocket for care. We also know that, subsidies for that coverage through the marketplace, 20% of Alaskans get their coverage through the ACA for less than $10 a month because of those funds that are coming in to help that cost sharing from the government, which is pretty incredible. But we also, which I think people were speaking to, the Medicaid expansion that happened under the ACA has just dramatically impacted the health of Alaskans and their ability to get care. 72,000 Alaskans were covered from the Medicaid expansion. So that's not who was covered before, but who got coverage because of it. And actually this year, what's the number? There was more folks that got ACA coverage and Medicaid than ever before in Alaska. So that's very exciting. I have it in my notes here somewhere. If you are a numbers person, I can pull it up for you. Yeah. So we have so many people in care. There's 200,000 Alaskans rely on Medicaid, whichever. It's a third of it. I am one of those Alaskans who was on Medicaid. It was life-saving care for me when I needed it, and now I am happy to fight to protect it for others. I also did live in rural Alaska. I lived in Cantwell, and I would always tell people, like, I don't live rurally because I could take a road to a hospital. And that felt like such a unique gift that was so different than my other friends and family who were off the road system and didn't have that option. So when I lived in Cantwell, I would have to drive every month to the pharmacy in Fairbanks to fill my prescription. And I did the math of how much money I paid in gas and time off work in the summer construction season. I worked construction at the time. And I made about like $1,400 less than my coworkers who didn't need life-saving medication and didn't need to drive to the pharmacy in Fairbanks. And again, feel very lucky that I had that option, but still had to drive there to get it every month. We also know that Medicaid provides, right, life-saving care, especially in repro health, not just birth control and access, but also cancer screenings. In Alaska, the rates of cervical cancer for women over, I think it's like 50, are actually going up as less people are thinking they need to access reproductive health care. So we provide cancer screenings, STI treatment. We have an STI epidemic here in Alaska. We have some of the nation's highest rates of chlamydia, gonorrhea, syphilis that we see going up and not down, which just shows further need for expansion. 1 in 5 women of reproductive age in Alaska is on Medicaid. It is 100% not just the backbone of our medical system, but also what people out of emergency hospitals. Reproductive health care is essential health care, and if it is not addressed, then it does become emergency care when it doesn't need to be an emergency. So we need to continue to uplift Medicaid and the ACA so that all of us here can continue to do the great work we do, which is provide high quality healthcare. And thank you so much for having me.
Thank you so much, Rose, for joining us. Are there any other questions, Rachel?
So sorry, I was muted. We have one more question, if anyone would like to answer. That question is, how can community members, healthcare providers, and policy members across Alaska work together to ensure that healthcare costs don't force people to lose coverage or forego necessary care? Anna, you can go ahead and answer if you'd like.
Yeah, thanks. And then I'll apologize in advance. I have to sign off in a second too. But I think, as a local policymaker, I feel like I don't have a lot of control over what's happening, right? And I think a lot of people feel that way. But I think telling these stories is step one, and just reminding people that these are real stories, real people, and this is what we all rely on to live in this world, right? In America. And just bringing that reality every day, because it's easy to say, let's cut government. It's easy to say there's too much waste, or, whatever narratives are out there, but this affects real people. And so just showing up and reminding people these are real stories and this is our health. That's what I recommend. Thank you.
Thank you so much, Anna. Looks like those are all the questions we have for today. So Amber, I will turn it back to you.
So as we wrap up, I just want to thank everyone, our speakers, our attendees, our partners for being here today. Your voices are powerful and they do make a difference. This makes a difference. Healthcare is personal, and hearing your stories puts a face to the policies we fight for every day. Judy, did you have something?
Yeah, there's one super important thing that people can do to help support Medicaid providers, which is going to be a really big part of making sure that people don't miss, that we don't think about a lot. And that is making sure that if you're fortunate enough to have private health insurance, doing your best to choose providers who take Medicaid is really, really helpful to those practices, because the Medicaid reimbursement rates right now are so low that a lot of clinics deliver those services at a loss. And we can use the good benefits from our private health plans, especially our excellent union health plans, to help providers offset those costs. And that includes Planned Parenthood, where you have clinic access for annual screenings.
That is an excellent point, Judy. Thank you. Well, I think that we have, I mean, thank you everybody for coming to this event today. These are always very emotional. I'm very grateful, and thank you for being brave and stepping up and telling your stories. And with that, we will wrap up. Thank you.